Hi, welcome back to the Coder Podcast. I'm Ollie Flower.
And I'm Roger Harris.
Here's a podcast from our Coder 22 event, which I think we really feel was our best content yet. It was our best event yet, and it was so good to see everyone back together again after such a long hiatus, right?
So good. It was friggin' awesome to be back together. So much to be proud of. Agree. Maybe our best content ever. And how about having a Climate Active or Australian Government Climate Active certified carbon neutral event? That's a first.
It was one hell of an achievement there.
Massive achievement. And there'll be lots more on the website that you can track down about how we did that.
So please go to the website, check out the other podcasts and video content, the YouTube channel, and you can find us wherever you get your podcasts. And do share it with your network, tag us on socials, and spread the word, because this is the last Coder event and it's been one hell of a ride. So thank you for everybody who's been part of it.
Yeah, an absolute privilege to have been part of it. For more on the sort of winding up of Coder, check out on the website, and hope to see you all soon.
See ya.
Thanks, Ankur, for that very powerful talk again. And thanks to all of you for sharing those stories with us. Liz, I might see if there's any questions coming through.
So at the moment, I don't have any questions, and I'm not surprised by that because I think we've had quite a compelling session. So I'm going to make a suggestion. We'd already, Jesse, decided we weren't going to debrief this, but I actually run a thing called Compassionate Conversations. I try to do that in most wards at the Royal Brisbane every month, and I actually think that's what we need to do here. So if you've got questions, send them through. But I know I've got lots of questions. Do you want to start off with do you have questions for our speakers, or are you happy for me to kick off?
You kick off, Liz. I'd hate to steal your thunder.
I was hoping you would say that. I guess I'm going to ask, first of all, to the panel. I've always really believed that one of the things I wish I had been taught at university is there's almost like this developmental process, not just about learning in terms of technical skills, but learning in terms of, and it's not coping, it's learning to live with those really big emotions, those really big events. None of you are new graduates. When you look back across the course of your career, can you see your ability to cope with those really big emotions, those fraught times? Have they changed? And what, if you had the opportunity, what would you go back and sort of say to your new graduate self?
You want to leave that?
So one of the best pieces of advice I got, and I'm ashamed to say I was possibly still drunk or hungover at the time, was not to ever go home and drink alone. The context of possibly still being drunk or hungover is that my year at Monash University was the last year that was allowed to have their graduate ball the night before signing the medical register. So many of us arrived directly from the medical board to sign the medical register, and we had this fabulous talk from somebody who gave us advice on how to cope, and I actually will never forget it. And one of those pieces of advice was, do not go home and drink alone. Mm-hmm. I think that's been excellent advice, and I would give to myself and to others. I have a group of friends who happen to be the people that I studied for my specialty exams with, and I think a lot of us will have those. I hope that people have that group, which is usually a small number, who the people that you know that you can call at 3 o'clock in the morning or after something like that, and by and large will pretty much pick the phone up no matter what and just listen. Mm-hmm. And one of the big things that stayed with me from SMAC 2019 was your sit in the rubble and don't try and solve the problem for myself or for others. Just sit in the rubble and listen.
Good.
I think from me, a knowledge that this too shall pass, and being able to see the end of the job, knowing that in an hour's time we'll be doing the paperwork for this job. But when you're in it, you can't imagine that But you get that perspective after years of experience that we'll be doing paperwork for this in an hour and this will pass. And then also, as Ankur beautifully put it, find that silver lining. I think it always surprises me. We get doctors rotating through my program, and they're always surprised at how many cardiac arrests that we go to as paramedics or in pre-hospital. And our percentage of getting ROSC is about 20-25%. We see a lot of dead people, but we have to find that silver lining, whether it's the way we broke the news to the patients or include the family in the resuscitation, or the way they saw us work caring for that patient as if it was our own loved ones. So find that silver lining.
Great.
What I think is, like we were discussing earlier also, development and learning is a constant. It doesn't change, right? Change is constant and learning is constant. And you're going to learn to cope with different situations at different times of your life in different ways. Sometimes you might not know how to cope with it. Sometimes you might just observe somebody else coping with whatever they're going through, and you feed in from that.
Mm-hmm.
And sometimes you go ahead and you discuss it with your colleagues, like we did in this case with my team. And a lot of times now my residents come up to me and they ask me, as we got so close to a patient and we lost him or her. What do we do? And the first thing I tell them is, it's actually a good thing that you're acknowledging the fact that you got close and that you're not in a good space as of now. But I feel talking it out with whoever was close to you is very, very important. And that's something that I did not have when I was, just a fresh graduate and I lost a patient or something. I didn't know how to behave, and I think probably that's when a little bit of compassion fatigue also starts to come in. And when you don't know what to do, and you're like, okay, fine, let's just go ahead, and this is what probably life is all about. And then you sometimes lose the connect with your own human side. So I think as a team, like you had mentioned, the team is really, really important. If you have a good team and you talk in the team with each other, that's really going to take you to the other side.
John, you're really old.
Yeah.
Do you have any advice? That was naughty. Do you have any advice yourself?
Didn't look old last night, did I? On the dance floor.
You were going off.
No.
Do you have any advice, wisdoms to share with regards to that question? Do you look back at your registrar self and then how you manage those big emotions now?
So I feel like I haven't been great at it over the years with my own personal emotional control and in terms of coping with things. And I think I was a bit prone, especially during the early part of the pandemic, to going home and having slightly more wine than I should have. But I feel like, one of the powerful things for me has been to name the emotions that I was feeling and trying to get a label on them. So I think that helps. So I identified, and I think a few of us did, that I was anxious about giving COVID to my family when we didn't really know how dangerous a disease it was, and especially in kids, we didn't know what would happen if they got it. I think I identified that I was just physically and emotionally exhausted as well. And once I'd identified those two things, I realized alcohol isn't a great fix for exhaustion. It actually makes it worse. And you get a bit of an alleviation of the anxiety, but it doesn't help with the fatigue. And so I started to manage myself a little bit better. So I think naming emotions is really important.
Yeah, name it to tame it. I'm going to ask the panel, unless you have a question.
I had a little follow-up question.
Okay, you go.
If you don't mind.
No, I don't mind.
Which was, there was a really powerful moment back in your presentation where the neonatologist managed to, there was this snapshot of humanity where he just did a normal thing, he or she just did a normal thing, approached the patient and have you got a name? And I was just wondering how we, especially when we're really busy or when we're very stressed, how we can shoehorn little bits of humanity into our work.
I think it's a really important question. I think it still is and has been a really important issue within the pandemic. I mean, if I just think about how I now look on the ward or in maybe not as much in the operating theatre because I've always worn a mask except in the UK. We're now, at one point we were in goggles and visors and N95 and all the rest of it, and we're often still in goggles and N95, so there's the loss of that level of connection as well as the non-verbal, because I think that's a really important part, and often in maternity teams. I think some of it is about this and having the conversations, and also naming that are we doing that, and that's an important part of what we do, and naming that that's some of the joy for us. So for me, one of the reasons I do what I do and I continue to work in that area is that level of connection, both with patients and team members. And so I think taking a moment to ask people how they are, to do huddles and find out something about someone, what their name is, what level they are, and try and have that connection with each other and with patient and family or whomever else is there, is really important. But I think that it has been a really difficult thing, because I think we're very time poor, and more time poor than we've ever been.
Yeah.
And so I'd be interested in other people's, what they do.
I guess what I wanted to ask is, my PhD showed very clearly that the number one support for healthcare professionals was other members of the team, unless their partners or family were healthcare professionals who, not just if your mum worked in an aged care facility, then often, they wouldn't talk about trauma stuff even with them. But on the whole, people went back to the team. What for each of you do you think the role of the team has played in being the support in your careers?
You want to start off? Should I start off?
No, you start.
You go.
You start.
So my team's been my second family for sure.
Yeah.
Absolutely. And we bonded way better during the first COVID lockdowns back in 2020, because we got holed up in the hospital. We were staying there together for about 2 or 3 months.
You didn't go home at all?
We didn't go home.
Wow.
So, I mean, that was a time where, we bonded off duty, on duty. We had to be there for each other. We had no other options, right? And it's not that we were working together for the first time. We had been together for the past 7, 8 years. But this is the time we actually saw our personal sides, and everybody was missing their families. So everybody had to gel in together. And that's how our bonds became much, much stronger. And I mean, now even if I have personal issues at home, I go discuss it with my teammates at work, not just for gossiping. Yeah. Not just for gossiping, but then they do give me some good advice now and then. So I think it just it just works both ways now. Yeah.
Yeah. The rest of you?
I think it'd be a bit harder for me as a single responder. The ambulance crew I might deal with, I might not have a big history with them, and we might not see each other for weeks or months after that case. So I've got some other really good support systems. So we'll do an immediate debrief afterwards, which is fine. But the deepest stuff, I've got a small circle of colleagues and friends who have travelled the same road. But we're also lucky that on the Gold Coast, University Hospital has a particularly strong relationship with the pre-hospital side, and we're encouraged to attend their meetings and debriefs. And in particularly difficult cases, we've done debriefs with that group, and there's, I suppose, familiarity in seeing the same faces and sharing that same journey with those colleagues. So that's probably my second go-to point beyond my small circle.
I think I would echo what Enko said, although I didn't live in the hospital, although it felt like it at sometimes. And I would probably step back. I've moved around Australia and internationally quite a bit over the past 15 or so years, but I actually first started working at the Royal Women's Hospital 20 years ago. So to some degree, it is my other home and my family, and I kind of would echo that. And I think certainly in the past 2.5 years, the teams that I've worked with, we have in some ways gotten closer. In other ways, there's been more distance, because one of the teams I work with, we haven't been able to meet up as much, and a lot of it's been over Zoom. So I think there's been some silver linings and some opportunities to get closer, and in other things there have been some barriers and impediments to the type of closeness that we already had.
Okay, I'm sure I just saw a message here from Jessie saying, What role has wildly inappropriate and dark humour had in being able to cope? I can't relate to that. So if someone on the panel could perhaps speak to that. And I'd be interested even from a cross-cultural perspective, like, is humour part of the way that kind of psychologically reset and step back from what's happening?
For me, that's like my first line of defense.
Yeah. Well done.
That's how I usually start off.
Yeah.
And then I look at the seriousness behind it, or the deep parts of the story behind it.
Mm-hmm.
But yes, definitely humor does help. And I mean, even during grief, if you have a little bit of humor, it's only going to be taken, I mean, for yourself, it should be taken positively. It's not like you're making fun of something, but, your brain, I think, just feels better, your heart feels better if you have humor around you. And sharing that with your team is equally important.
Mm.
Absolutely.
Gary, do you use humour?
No, I've never done that. Yeah, no, I've had some conversations in ambulances at 3 o'clock in the morning that would probably land me in jail. But the problem comes in when someone who is outside of that experience that you shared hears that.
Mm.
And particularly your junior staff members who think that behavior is normal in all cases, but don't understand the deeper protective reasons for saying that at that time. I think that we can damage people and create the wrong culture. So I'm a lot more guarded now in a senior role. I have to be careful when I say those things.
Yep.
And again, save that for my circle of trust in more appropriate times, because I realize the example I have to lead sometimes is not conducive to doing that, but it's necessary.
Yeah, great answer.
Yeah, and the humor side of it should not be misinterpreted as empathy fatigue.
Yeah.
They're not the same thing.
No.
Yeah. But outsiders can actually think that ways.
Yeah, great point. Beck?
Yeah, no, I would agree. I mean, I use humour a lot, but I think I would agree with what Gary just said. I think the more senior I've gotten and in leadership roles, I am probably quite cautious about it. And I agree. I think there's been, you heard we did a lot of work with teams that we don't usually work with, and I think that a lot can get misinterpreted as well in terms of the different humour or different perspective of things. So I think there's absolutely a time and place for humour. In maternity, it's often at 2 o'clock in the morning. It used to be with tea and toast till they took the toaster away from us. Well, because otherwise they had to call the fire brigade, which was never a problem really, but apparently it was. Yeah. Yeah.
Mm. Do you have any questions, John?
Well, I was just sitting here that we're talking about really the humour thing is all part and the importance of team. I think we do have to acknowledge that at the moment, because we're so depleted in staff numbers, our ability to get together and have post-event huddles, debriefs, things like that, we've got to acknowledge that's going to be impacted because everyone's so busy. Like in our ICU, all the nurses have got more patients than they normally have. And to get people together to do that is going to be tough. And I know, Liz, you were saying before this that you really hate doing this stuff over Zoom. And so I wonder how the pandemic has affected our ability to get together and have those post-incident kind of conversations.
Yeah, and we've got a few comments like that on Twitter who people are saying, we're now trained not to do that, and we're asked not to get together in the tea room, and we're in rotations where we never know who we are. So yeah, how has the pandemic changed that? And more importantly, what do you think we can do to kind of work around that?
You go first.
So I think that has been a huge problem. And actually I think the hospital I work at, I think it was a problem before the pandemic, because the hospital was built 12 years ago and they removed a lot of that shared space in terms of any learning spaces, and the tea rooms were tiny to begin with, and there were a lot of areas that then were being taken up for other purposes like offices or whatever, and even just having fewer people in a lift or in the corridor, because I think actually some of those corridor conversations, or in the lift at the end of a shift, or in the tea room, or at days gone by when you did have just a staff cafeteria, I think that those are really a missed opportunity. And so I think it's been really hard. I think to some degree at various points WhatsApp groups or equivalent have to some degree replaced that. I have seen that go really badly sometimes with humour used either inappropriately or misconstrued. I think it comes back to it's something we need to keep working on and find a way to do it, because I do think that, as reflecting on what you said yesterday about belonging and connection, I think it's so important. So I think it's something that we need to strive for, and perhaps for those of us in leadership roles model, and that it doesn't have to be long. Like, it can be as short as a minute or 2 minutes, or asking how someone is and really wanting to know what that response is.
Do any of you want to comment further?
COVID just brought us, closer, and we still have our rooms where we go in and do a debrief or a team huddle. Not a problem with us. We've just taken COVID as a way of life now, and I think that's how everybody has to move forward now. So, yeah, not affected us too much.
I feel heartbroken because I feel like when I started my career, I knew everyone in the whole hospital. Do you know what I mean? You walk through and you knew everywhere. And so I try to have Amy Edmondson in my head and do teaming all the time, because I don't belong to a team anymore. And so when I get in the lift, I try to talk to people all the time. And the other day, accidentally, I started singing Kung Fu Fighting. And people just think I'm a mental health patient who's escaped. And I find that really disappointing, because I think we should be teaming in the hallways. I've got something in common with you. We've got a shared goal. We're all working to put a man on the moon. Do you know what I mean? Like, I feel like we've got to start striving for that more, rather than I just belong to this little tribe and the rest of you, good luck for the day. If there is one take-home message, I guess, that you want to share, that if you reflected back across your career, you too, John, if you could think of one thing that has always made a difference in terms of your well-being, what has it been?
Do you want to start?
One thing, probably people.
Yep.
Yeah, people, friends.
Get a dog. That's it. Walks with a golden retriever are the cure for most things.
Teamwork makes the dream work.
Yep.
I mean, that's something that's going to be there.
John?
I think for me, it's really engaging with the people that you work with, just getting to know them just a little bit, just makes the whole week work better, the whole team work better. So just engaging with people. And that's what CODA is all about, right? And on that note, we're minus 143 seconds, so I reckon you should give us yours, Liz, and then we should wrap this session up.
Having a high-functioning team means excellent care for patients, and so making sure my team members are okay means excellent care. And so for me, I've tried never to drop the ball on that. And I guess what I've heard from here is little things really matter. And so never miss the opportunity to check in, touch base, make someone laugh, make someone feel, feedback something positive.